Here and to those joining online, my name is Evelyn Kasuga, and I'm chair of the board for Arizona Town Hall. So on behalf of our board of directors, our president, Tara Jackson, and her team, and the many town hall volunteers throughout Arizona, we are delighted to welcome you to the inaugural, this is the first time we've done this, yes, inaugural background report launch event. For those of you new to Arizona Town Hall, just a little bit, we are an Arizona-based nonprofit, and as Tara likes to say, a multi-partisan organization that educates, engages, connects, and empowers Arizonans to resolve important issues through consensus using a process based on respectful dialogue that values diverse perspectives, builds relationships, and fosters leadership development. We've been doing this now for 60 years, so it's a big celebration for us as well. So thank you so much for joining us. Our topic this year, mental health, substance use, and homelessness, touches individuals, families, communities, and all of us in some way. And the background report, which you can find on our website and also use the QR code. We've gotten that sophisticated. And the panel of experts that you'll hear today will provide a unique perspective and a resource. Throughout 2022, Arizona participants, hopefully many of you here in the room, as well as those of you online, will be engaging in more deeply on the topic in your own communities, with a culminating statewide event sometime in November. So please keep us on your radar on how to best address these intersecting issues. So now I have the honor to introduce Dr. Cynthia Leitz, recently named Dean of the ASU Watts College of Public Service and Community Solutions, one of our key partners and stakeholders. Dr. Leitz, there she is.
Good morning, everyone. Welcome to those who are here in person and those who are joining us virtually. It would not be an event these days if there weren't some technological glitches, and that just means this is off to a great start. It is truly an honor to be able to welcome you all to Arizona State University's downtown campus. It is the home of Watts College of Public Service and Community Solutions and 5 other academic colleges that are located here on our downtown campus. And several of our other colleges also offer degree programs down here as well. We just celebrated the 15th anniversary of the downtown campus last year in 2021. And it's really incredible to see how the growth of ASU has in many ways transformed our downtown. I'm really originally from outside of Chicago, but we have lived here now in Arizona for 26 years. This is home. This is my community, the place that I care deeply about. And so to be at an institution that's committed to community in the way that we are is personally very meaningful for me. Now, some of you, I think, have heard our charter. You know that at ASU, we're committed to measure ourselves not by whom we exclude, but whom we include and how they succeed. We also are committed to conducting research that has public value, and we take fundamental responsibility for the overall health of our local communities. And that's why an event like this is just so in line with who we want to be as a public institution, that we have a responsibility to prepare the next generation of public servants to make a difference in the world. And at the same time that the research we do has actual value to those of you doing the work in policy and practice, many of whom, thank you, by the way, are joining us today to give their expertise as part of the dialogue for this important topic. And so there's the education side, the research side, the community side sometimes confuses folks because they say, why is that the responsibility of an institution? It is equally as important to us as our other aspects of our mission, both at ASU and particularly for my college. I also want to recognize the law school who is a sponsor of this event as well. We work very closely across disciplines here at ASU. And so just love to have you here at our campus. If you have not been here before, that you have a chance maybe to walk around a little bit and to see how embedded within the community we are. Now at Watts College, we've got 4 academic units and over 20 institutes, centers, or offices. They are, of course, all a special, you know how with your children, you have to make sure you give the love to everyone, but I will tell you that Morrison Institute is really a premier example of having a long-term history of making a difference in the community. I would like to recognize Andrea Whitsitt, her incredible leadership, and many of her staff are here. Thank you for the work that you did on the report, for the authors that you brought together, and thank you also for incredible partnership with Arizona Town Hall. Your vision and mission are exactly who we want to be. And so this partnership, Tara, and the rest of your group who's here today means a ton to us. So let me talk briefly about the topic. This is such an important, timely topic. I'm really grateful for the experts who are joining us today, and that this is the topic that has emerged as so important for this year. Mental health, substance abuse, and homelessness. You really can't talk about one of those particular social issues without talking about the other. And I understand that that's part of what we're here to accomplish today. I've been at ASU for 18 years, but prior to that, I worked for over 10 years as a social work practitioner, working with folks struggling with the very issues that you all are talking about. So this topic is both important to me professionally, and I can tell you it has touched my family personally as well. My guess is that most of you here virtually or in the audience also have been touched by concerns related to mental health, substance abuse, and/or homelessness and their intersection. So thank you for bringing attention to such an important topic. I'm really looking forward to this conversation. So at that moment, I think it's a great time for me to introduce Christy Eustace, who was a big part of leading this particular report and this effort. So Christy, come on up.
Okay, thank you, Dean Leitz. Find my little clicker. Okay. Hello, my name is Christy Eustace. I'm a senior research analyst at Morrison Institute and one of the 2022 Town Hall Report editors. For those of you who are not familiar, Morrison Institute is a nonpartisan public policy center located in Arizona State University's Watts College for Public Service and Community Solutions. As an institute, we analyze important policy issues to advance public understanding in Arizona and beyond. We develop tools and resources to help communities make informed decisions, and we provide forums to engage with public policy research. And I'm really here today just to set the stage for these wonderful panelists by providing a brief overview of the report, including why this topic was chosen, kind of our approach to editing and compiling the report, as well as the overall report structure. Okay, so mental health, substance use, and homelessness was selected by the Town Hall Research Committee as the report topic because of the challenges and broad sweeping impacts associated with the intersection of these issues. So according to the 2020 point in time count, there were nearly 11,000 people experiencing homelessness in Arizona. 1,863 people were reported as having chronic substance use, and 1,718 were designated as having a serious mental illness. Now, it's important to note that these numbers are actually undercounts, given that the point in time count is conducted one day a year by volunteers. And this number also doesn't include individuals who are marginally housed. So that's folks who are living with family or maybe in substandard conditions. If we add these individuals to that estimate, it propels this number to nearly 44,000. That is well over twice the number of people it takes to fill the Phoenix Suns arena. Moreover, the effects of these issues ripple across our communities and our neighborhoods and impact so much more than the individual who is experiencing them. There are impacts on the health and social service systems, emergency systems, and the criminal justice system, as well as impacts on our local economies and public spaces. Then there are the mental and emotional tolls for the individual and their support network, as well as financial consequences for families, communities, cities, and the state. In sum, this topic was chosen because of its relevance, because these issues and their intersection in one way or another are likely to touch all Arizonans. So while approaching the report, there was a collective effort to produce a document that is focused, fact-based, descriptive, and representative. Focused meaning that to the extent possible, content is focused on that unique intersection of mental illness, substance use, and homelessness. Fact-based, meaning content is supported by data and literature and/or is grounded in the author's lived or professional experience. Now, we encourage authors to include their experiential knowledge, not only because it's incredibly valuable, but because often this was the only information that was available. Descriptive, meaning the content explains the issue and doesn't advocate for one position or approach necessarily. And then representative. So the report includes statewide data and perspectives. So authors are experts from various service delivery organizations, government agencies, and academic institutions from across the state, and that's including rural Arizona. Okay, and this last slide just provides a snapshot of the report content and structure. The complexity of this topic really resulted in quite a lengthy report. Because of this, we crafted an introduction to kind of give readers a preview of what's going to be in the report, and as well as just to provide some base level information. There are also cross-references throughout the report, so hopefully readers can navigate easily to information that they're specifically interested in. So the report begins with an overview of the issues and their intersection. Then there is an overview of integrated treatment and care in Arizona, structural factors that produce and perpetuate these issues, and options for recovery and stabilization. The report then concludes with 10 spotlight chapters focusing on specific populations who are disproportionately and or uniquely impacted by the intersection of mental illness, substance use, and homelessness. Although these issues do and can impact anyone, we also recognize that that not all people are impacted equally and in the same way. So thank you for joining us today and for your interest in this important topic. We'll hope you will explore the report and join us for the statewide and community forums this fall. Lastly, I just want to extend a sincere thank you to our report authors for contributing their expertise, time, and energy to such a critical topic and resource. And at this point, I will pass it back to Town Hall.
All right, excuse me. Thank you, Dr. Leitz, Christy, and the Morrison Institute. We are grateful for your ongoing support and partnership as we collectively create solutions to most of these challenging issues facing our communities in the state. So to shift here a little bit, we have many generous sponsors, as you can see on the slide. Maybe Alex, she'll pull that up. And to shout out to a couple of specific to this event, and Dr. Leitz already named them, the Sandra Day O'Connor College of Law, who's our venue host, and the Giesel firm, whom you'll hear from later, who's our fiscal sponsor for the background report launch events. There's more than just today, by the way. Yuma is having a virtual event tomorrow, and Flagstaff at the end of this month as well. So I'm pleased to announce that we've just learned also that thanks to a generous investment from the Diane and Bruce Halle Foundation, Arizona Town Hall will be able to support more community and future leader town halls throughout the state of Arizona. So after you hear from our expert panel, be sure to contact us if you'd like to bring town hall to your community. I'm speaking also to the folks online. So I'll move ahead with introducing our esteemed panel members whose bios you can find on our website. So we've got Tom Simplot, who's the director of the Arizona Department of Housing. And we have a stand-in for who's Jamie. We've got Shelli Silver, who is the Deputy Director for Health Plan Operations for the Arizona Healthcare Containment System. Amy St. Peter, Deputy Executive Director for Maricopa Association of Governments, MAG, and the Honorable Sarah E. Selzer, Commissioner, Superior Court of Arizona, Maricopa County, the Mental Health Court. And serving as our panel member, here, I'll put that up there now, because I was not Pat. The Honorable Judge Pat Norris, retired, who is the immediate past chair of Arizona Town Hall Board and the current chair of our research committee. Pat, take it away.
Thank you very much. And I'd like to thank our panelists for being here. For those of you who have not yet downloaded the report, here's the first page. This is the cover. It is well worth reading. The folks at Morrison and the other authors who participated in this report, and Christy, hats off. My goodness, what a job. It's phenomenal. This really is so informative. I encourage you to download it and then read it. It covers all aspects of this topic. So with that said, let's go ahead and begin then with our panel discussion. The topic, again, a plug, the topic is mental health, substance abuse, and homelessness or substance use. These topics, we know that homelessness, for example, there are many, many causes of it, but we have focused on mental health and substance use. Why is it important to consider these three areas together, and how do they relate to each other? Do I have a volunteer to hit this off? Please. Amy?
Great. Thank you so much for that question. You know, these three issues are so intertwined, particularly when you're looking at the front end as well as the back end of homelessness. So when you look at the front end, having a mental health issue or a substance use issue can contribute to someone experiencing homelessness. But then once someone is experiencing homelessness, even if those two issues didn't originally contribute to that experience, they may very well endure and start to face mental health issues and substance use issues because of the trauma associated with experiencing homelessness. So we need to be able to fully integrate our systems of care, because a fractured system results in fractured care, which prolongs the trauma and the pain that people will experience as a result of experiencing homelessness, as well as the other two issues combined. So it's absolutely critical because these three issues are so very well intertwined. We need to be addressing them together.
Other members of the panel on this question? Yes.
And by the way, you're going to hear this a lot this morning. I agree with that. So I'm Tom Simplot with the Arizona Department of Housing, and I'm so happy that we are actually having this conversation, because you cannot have the conversation about the first two issues without talking about the housing component. Because once they lose their housing, it is that much more difficult and costly from a community perspective to be able to rehouse that individual and to address those underlying symptoms and underlying issues.
I'd like to add.
Please, yes.
So I would put forth that when you have these three words together, you need a fourth, which is Medicaid. Clearly, homelessness, mental health, substance use, and Medicaid all run together. I would also share, and I'm sure you're very familiar with this, that there's quite a bit of national statistic today that talks about the fact that only about 20% of a person's health outcome is really related to the acute and physical care, healthcare that they receive. 80% is really related to socioeconomic factors, of which we know housing is a predominant. And so for that reason, Access and other Medicaid agencies nationwide are looking at really whole person care type initiatives to try to address these non-healthcare related factors. There's a big challenge there though, because the federal government only contributes to funding for medical care. And so trying to identify how to address socioeconomic factors using only state funds or trying to find federal funding is where the key is.
Now, let me remind you that if you have questions, if you'll write them down on the little cards we distributed before we began, and just raise your hand. I should be able to see your hand, and I'll ask Tara to get your card. In light of what we've just discussed, what actions or approaches have you or the agencies and organizations you work with or are familiar with taken to create this more holistic, in our household, we call it the full dog, the holistic approach in addressing mental health and substance use and homelessness? Yes, Tom.
Thanks. So first, it's so important that the agencies that have a role and the organizations that have a role in this are actually communicating. So what we know for a fact is that the housing industry didn't know how to speak healthcare, and the healthcare industry in a lot of ways didn't know how to speak housing. And that may seem rather basic, but it's so true. What we've learned over just the past year and a half is how important it is to have regular engagement, regular communication, and to have regular updates about what is going on in the community, whether it's through the courts, through the healthcare system, or through the housing industry. A fact many people don't realize in Arizona is that Access is one of the largest housing providers in the state of Arizona. That says a lot. That wasn't the case 10 years ago, but it is today, and it will continue to grow, especially as we continue to develop these relationships and to merge our resources and leverage those resources every way we can.
Yeah, well, I'd love to go again.
Absolutely, this is a panel discussion.
I appreciate Director Simplot's comment. Yes, actually, we're the third largest housing administrator in the state. And so we have actually a very long history in housing, but we also have new initiatives. So I'd love to just touch on those briefly. So we have about $30 million in state funds. And by the way, if you can't tell, my background is finance. So I use a lot of dollar statistics, funding statistics. So we've got about $30 million a year appropriated from the state through the general fund. So that's our tax dollars that goes toward housing. About 27 million of that is toward housing vouchers. So actually paying for rental subsidies for our members. And another 3 million is in capital expense. So again, long history in providing that housing. Despite that dollar amount, $30 million sounds like a lot of money. We do have a waiting list for housing of over 3,000 members and growing. I think the last time I looked, in fact, one of my staff updated that stat this morning. I had in there that we had a list of about 2,800. And so that was about less than a year ago. So as I mentioned a minute ago, we're really interested in whole person care and how we can try to leverage federal dollars. So one of the things that we have done, and you may have heard about if you're in this space, is we submitted a request to CMS to try to draw down $60 million worth of federal funding to match against our 30, which would give us $90 million to spend on housing. And not just housing, but other types of related services such as outreach, early identification, early reach into prisons and jails, other things that Access can't currently fund. So really trying to expand our footprint in who we can touch, where we can touch them, and draw down that funding. I could go on, but I know other folks I'm sure want to speak.
Amy?
Thank you for that. So we do really believe that we need a holistic approach to this. In fact, when we developed Pathways Home with a number of partners, and some of whom are here, when we developed that plan with local and tribal governments, as well as our partners throughout the community, there are 3 action steps in that plan. One of them is really focused on how do we work across sectors? How do we integrate these systems of care? How do we share our funding, our data, our technology, our information to bring people together? And how do we address these 3 issues in one integrated approach? And that's been critical to the success of the plan. I would also like to point out that woven throughout the plan, including in that 3rd step, is the idea of racial equity. So when we talk about a holistic response, we need to keep in mind that not all people share benefits in the same way. And some people shoulder a disproportionate share of the burden. And so we need to be able to, as we're working and striving towards these holistic approaches, we need to make sure that we're doing so with a racial equity lens to make sure that we're responding to people in an appropriate manner.
Go ahead, please.
So I'm from the Superior Court. Obviously, we don't manage housing, but we do touch on substance use and mental health in various different corners of the court. And we are working very hard to figure out how to integrate that so that if you are in a criminal proceeding, but also in a civil mental health proceeding, and maybe also in family court or some other corner of the court, that we are figuring out how to coordinate that with probation, with your outpatient provider in mental health. And that work has been stymied by COVID, but is back and proceeding in really innovative ways. And so hopefully folks who are both in the civil, criminal, and other corners of the court system can be better served for resolution in multiple areas without having to deal with multiple people in multiple courts.
On that point, Commissioner Selzer is assigned to what we in the legal world call the mental health court. And I imagine that a number of people who are participating either online or here have not heard of that court. You think of the Superior Court or the trial court, municipal court, but mental health court. What is mental health court and what is your role in it?
So there are lots of courts who call themselves mental health courts. The criminal post-conviction diversion courts call themselves mental health. Rule 11, so are you competent to assist in your defense, is also a kind of mental health court. What we do is the civil treatment orders. It's not criminal. You haven't been accused of breaking any laws, but if you are not voluntary for necessary treatment and your mental illness is impacting your ability to function, you may, if me or one of my colleagues decide that's the right thing to do, that there's sufficient evidence, you may be assigned to up to a year of mandatory mental health treatment. And most of the folks are also assigned to outpatient providers, outpatient clinics, who are responsible for providing that treatment and monitoring that person. And if they're not stable, the carrot or the stick, whichever way you look at it, is that they may have to go back inpatient for stabilization. So we have about 10,000 folks every year that come through our system, and about 3,000 folks that are on these one-year treatment orders in Maricopa County.
My next question is going to have us address best practices, but to segue into that, on this point about Commissioner Selzer, the people who come before you who are suffering or experiencing perhaps mental health issues caused by substance use or for other reasons, do you see a distinction between how our systems treat people who have mental health issues versus substance use issues? And do you see that within the court system, specifically the division you're in?
Sure. What I do specifically excludes substance abuse, in large part because that is not treatable with medication. You cannot medicate someone into sobriety. If you have a co-occurring diagnosis of substance abuse and a mental disorder, we absolutely have jurisdiction and will bring you in. And then often, depending on availability, the outpatient provider will provide or at least offer substance abuse treatment on the outpatient side as well. So I lost the thread of your question.
Well, the point is that is in Title 36, which is involuntary commitment. We do treat people who suffer from mental health issues, but at least according to the report and some other of the chapters, oftentimes substance use is very much involved in mental health issues. And so we have this distinction. We treat some, but not others. And that doesn't seem to be consistent with this holistic approach we've been talking about.
That's true.
Okay.
But there, I think, are solid legal arguments to exclude substance abuse, in part because you can't medicate to treat it. This is a pretty significant infringement on someone's due process rights to involuntarily hospitalize them. And so keeping it limited is not a bad policy decision. One of the things that we do see is we get a fair amount of information about a person, and there's a lot of destabilization and decompensation that will occur with substance abuse in somebody who's co-occurring. So if you have to be sober for your housing placement, you lose your housing, your mental illness treatment starts to become pretty frayed, and then we may have you back in our courtrooms again.
Okay. Let's talk about best practices. And I'm going to start with Amy and then kind of go down the line of our panel. If there was one action item, and this is a tough to say one, but if there was one action item or best practice that you think that every community needs to know about in addressing this topic, this interrelationship of this topic, what would it be? Amy?
Pat, thank you for that question. I'd like to offer two, if that's okay.
That's okay. We won't count. Okay.
One is a bit more esoteric and others maybe a bit more of a practitioner focus. Outreach teams. We hear time and time again, well, they don't want help. And we hear that from people across all sectors, all positions, right? But often the outreach teams are the key to getting people to engage. Because if you're suffering from trauma and if trust has been broken time and time again, there are a lot of very good and valid reasons why you might say no, why you might say no 10 times. But the outreach teams are such experts at engaging people wherever they are and working with them to bring them into care in the best way possible. So I would highly recommend outreach teams, housing navigators, getting people out in the field and starting where people are at. I think that's a critical component. The second one, and it's a bit more esoteric and kind of going back to what the dean was mentioning as it started, is I would love to eliminate the whole idea of us and them. I think that's fundamentally damaging in every conversation. The more that we recognize that we're all in this together as people, as agencies, as communities, as systems of care, we will do more together and we will be more successful. The longer that we perpetuate that misconception of people being separate, the longer we prolong the damage that's incurred when those connections are severed. And we fail to recognize the connections that do exist. So I would love to have more outreach teams throughout the entire region, throughout the entire state. And fundamentally, I'd love to remove the idea of us and them.
Thank you.
Thank you, Amy.
Shelli.
And outreach teams is in our proposal. Yes. So let's
Yes.
hope for the proposal. So collective impact. And I feel like, I don't know about you, I use collective impact every single day in my job. Access Medicaid is incredibly complicated, and there's so little that you could actually do alone. There's no way one person can understand all the aspects that go into establishing policy to effectively serve 2.4 million members. The same is true related to homelessness. And I can say unequivocally that the Department of Housing and Access have really lived the principle of collective impact the last couple of years, working hand in hand on multiple projects. They are the housing experts. We have a really amazing housing administrator at Access, but that is not our mission. That's not what we spend $20 billion on. And so we're able to bring our expertise to the table, find services, find the providers, pay for those services, wraparound services, we think is instrumental to keeping people housed, and work with those folks who are experts in housing. And that's what every community should be doing, is finding the funding entities and all the various experts in each piece of the puzzle and working together toward the community good.
I think we've done a really good job reducing the stigma of anxiety, depression, PTSD. I think we have a long way to go when it comes to reducing the stigma of schizophrenia, and some maybe even also bipolar. I think we're kind of on the cusp with bipolar and stigma. And I think it's a lot harder to access care, not access, but to engage with care when you have such community, cultural, societal stigma around your illness. So to Amy's point that we're all in this together, we are all just one little bit of brain chemistry away from any of those psychotic episodes. And I spend a lot of my time thinking, there but for the grace of God go I. And so I think if we could reduce the stigma, it would really change the approach. And to the point about outreach teams, I agree that's crucial. One of the things that I see a lot is the difference between community teams, case managers who have had years of relationship with a person and who have had weeks or months of relationship with a person. Those long-term relationships are crucial and transformative, and really in many cases make the difference, from what I can tell, from somebody needing the court order for treatment and being voluntary for treatment. And there are lots of ways you can incentivize folks to stay in their jobs. There's lots of ways you can't. But if I get to wish for something, it is those long-term relationships.
So collective impact for me sums it up so well. I would just take it maybe one step further in the description or discussion is convene the experts in your community. It is so important to listen to what is going on in your particular community and what your particular needs are. And going back to what Shelli was saying, so starting a year ago, we started convening our health, housing, and homeless experts on a weekly basis on Zoom calls. And it started out with maybe a dozen individuals and organizations, and now we're up to 40 every other week, doing and talking about things like, what are we doing to prepare for the summer heat? And how are we addressing those on the street and those health-related issues that contribute to all of that? And so it's just those ongoing communications. I just think that's so important. And without that, we're not going to move the needle.
On that point, you all have mentioned in one form or the fashion, collective impact and working together. And just as an outsider on this, it has bothered me as I have been involved in these various programs that touch on these issues, that at least in other communities, we don't have this collective impact. And Access and Department of Housing and MAG, I mean, they are examples of working together for the collective impact. But how do we, as individuals, and we go back to our respective communities, how do we start to really move the needle to get other groups to have this collective impact and to be really meaningfully working together? Ideas? Answers?
Sure. I think there's a lot that we can do as individuals. We don't have to be the ones on the front line necessarily. And people can keep their day jobs and still support these really critical efforts. And it even comes down into things, what can they do in their own community? So for example, people cannot stabilize as well or as quickly if they don't have housing. So if every person would accept affordable housing in their community, that would do a tremendous amount of good. Instead, there's a lot of concerns, a lot of questions, a lot of misconceptions, a lot of fear around that. But if we could just get people to accept affordable housing in their communities, to take this as, again, all of us, and it's all of us together, and all of us need housing in every community, then I think that would do a world of good. The other thing that people can do as individuals is pretty simple. It's to volunteer. But when they're volunteering, instead of being focused on, I'm going to save this other person, is what can I learn from this other person's experience? What do I have in common with them? How can I be transformed by that volunteer experience? I think if we have people engaging on that personal level, both with their time as well as in their communities, then I think we'll be able to enhance the support that we have for that collective impact.
Other thoughts?
Just similar, really piggybacking on what Sarah said already, which is just suspending judgment and we're really working to reduce stigma, that every individual can play a role in that.
I would just add one other thing, and that is all politics is local, right, Marty Schultz? And you have to know what's going on in your community and your neighborhood to be able to address the resistance to affordable housing and the services that go along with that. It's kind of interesting that as the homeless population has grown exponentially across the country, including here in Arizona, it's not until it's in a particular person's neighborhood that suddenly they have the awareness and the desire to do something about it. Unfortunately, sadly, a lot of times those are also the individuals who fight the affordable housing or services that are needed to be able to address that situation. So to me, it's just all politics is local, and we have to be sure to bring it down to that level to start the education there.
We've touched on then, and you're right about politics being local, which, and you, without using the term NIMBYism, that's really what we've been discussing in response to this question. We know it's out there. And again, as individuals, or perhaps as representatives of our various organizations and groups, what do we do to address NIMBYism? What do I say to my next door neighbor? And we live about in Sunny Slope, maybe a half a mile from a couple of parks, and there are folks who are hovering in place and sheltering in place, and they're homeless. There's no question about it. And yet I know in our neighborhood, we have controversies about building affordable housing or just transition housing. So what do I say to my neighbor to get them to move beyond NIMBYism?
Boy, that's the $1 million question.
I know, really.
And my background was I served 10 years on the Phoenix City Council, and it was just always so interesting to hear the neighbors push back on any sort of density, any sort of housing, and quite frankly, any sort of services. And yet those would be the same people that would call and complain that there were homeless individuals living in their street, along the canal, in the bushes, no matter where they were. And sadly, so often their complaint and their question would be, do something about this. You need to do something about this, but they're not willing to participate in the resolution of that. So again, I guess it goes back to education at the very smallest micro level in our neighborhoods.
Yeah, absolutely. No, I would agree. It's always so frustrating too on a parallel but different path where people say that they want more roads and things, but then they don't like the construction. Well, we have to build it. We have to build these systems in order to make this work. So just a note on that. But in terms of the NIMBYism, and I think this is really the heart of Arizona Town Hall, it's all about having civil discourse. It's about being able to come together around the same table and engage in some really hard questions and being authentic in that too, because people at times will have concerns. They have questions. We need to be able to authentically engage in conversation with them to address those in a very candid way, a very constructive way. So often it's yes or no. It's not, those lines are drawn and people aren't willing to cross that line. We need to be able to see that same issue from a different perspective, to be able to put ourselves in the other person's position and to be able to call on their best selves as part of that dialogue.
I think it's actually interesting to me that you mentioned that you live in Sunny Slope, because we actually did.
You're welcome to come by.
I think my in-laws live in Sunny Slope. I'm there often. If I remember my neighborhoods correctly, I think Sunny Slope is a hot spot, right? And had, I think it's moved now, a behavioral health clinic. Yes. And I was peripherally involved, so I don't know every detail of it, but I think one of the things that we did in that situation, what Access did in that situation, and what we can do ongoing, and I loved what you said about, the civil discourse, and that wasn't always civil, but what we did do certainly was work together to try to alleviate the community's concerns by doing, real and constructive things based on their concerns. For example, we had to receive security plans from the provider. We posted information on our website that the public and the community teams, excuse me, could read about. We required, as I remember, if it's correct, we had them change the traffic flow for dropping off patients and picking those patients up. So there's things that we can do. We can address what those real concerns are, like the line of cars on Northern Avenue, and how can we change the parking lot or the entrance or the pickup location to try to address each of those pieces. And that's really the efforts that we can engage in to try to allow these businesses to be there where the hotspots live.
Right. We're in downtown Phoenix, a very urban area. And there's a lot of urban area in Maricopa County, but you know what? There's a lot of rural area in Maricopa County. And of course, we have the entire state of Arizona that has large rural areas or other tribal areas, rural, and so forth. How do the solutions vary, do you think, in addressing the intersection of mental illness, substance use, and homelessness when we're not in this dense urban environment?
I didn't know if Shelli was going to jump in there or not. For example, with what you're saying, Pat, the Arizona Department of Housing is primarily focused on balance of state, because that's where our resources need to be addressed or need to be focused. Because theoretically, the cities and towns in the urban areas are and should be and are the primary focus of using their resources in the urban setting. So it goes back to the partnerships and creating the systems and the structure so that we're using our state and federal resources in the balance of state to be able to address those needs on a local level. So we at the Department of Housing, I know Access does this as well as our other sister agencies, work very closely with our rural counties, our rural cities and towns, to be able to, again, identify what the needs are in the community, and then having that structure in place so that we can divert and direct the resources necessary to address those. Are we always successful? Oh, no. But that tells us we have work to do, and that's why we need to continue that conversation.
Right, yes. Amy and then Shelli, jump in.
Thanks, Pat. Every community, just like every person, has strengths and challenges. And so it's incredibly important that whatever solutions are being developed, that they're not developed for the community, they're developed with the community, that you have the community leaders, you have people representative of the population that you're serving being part of that development process. So for rural communities, we found that at times they are more under-resourced, but they often have a stronger social fabric, and that can be leveraged. For tribal communities, for our Native nations, they have a very different funding structure and very different social structures in some cases. So it's critically important to honor their priorities, to honor whatever direction they would like to move in, and to recognize that past broken promises can contribute to a sense of mistrust. It's important to be authentic about that. And then with the urban communities, everything is happening on such a bigger scale. And so it's important then to take that into account. So for all these three different areas, it's critically important that the community drive that solution because they'll bring different strengths and challenges to the table.
I think I would start with, I agree, borrowing Tom Simplot's words. I think everything that's already been said, actually, we know that, and I appreciate that Tom also said this a couple times, that each community has its own politics, it has its own needs, it has its own infrastructure, or worse, lack thereof, right? No transportation. Maybe there are, of course, counties without even a hospital. And so these things are just all added challenges. And so balance of state certainly is something that we think about. I would just, excuse me, agree again that these are all problems and they do need to come from communities to help find the solutions. The community needs are going to be different. In fact, there's, if you use data and look at data-driven approaches, there's certain counties where the substance use is perhaps the worst in the state. And so in that county or that city, perhaps their need for a certain type of a setting is different than the type of setting needed in another.
Can I, Judge?
Oh, please.
I have a more micro grassroots level viewpoint, which is just basic transportation. Even in Maricopa County, transportation to services is a struggle. Even if you call Beus or Uber, sometimes they don't show up. Somebody doesn't trust the driver and they don't get in. And so then they miss their appointment and things devolve from there. And I grew up in a very rural community. Transportation is undoubtedly an issue there. You just mentioned if you put the clinic where the folks are, but then you need to get to the clinic. And so absolutely community-driven solutions. I can't imagine a community in Arizona, including in Maricopa County, where transportation would not be part of that conversation.
Mhm. Let me remind our audience, if you have questions, just write them down. Spelling does not count. Give them to Tara, and we'll have you participate in this conversation as well. We have systems of care that we know. And the question that I'm going to ask now is, how can we create and sustain? Thank you, Director. Thanks a lot for being here. Thank you. Director Simplot had to leave for a meeting, and I'd like to then introduce you to the Deputy Director of the Arizona Department of Housing, who's filling in, and thank you, Cindy Stotler, who's with us today, and thank you so much for joining us. Thank you. So the question I wanted to now focus on is we do have effective systems of care. We do. But how do we expand them? How can we create more? We have incentives we could perhaps offer. What could those incentives be? We do have some inefficiencies. We know that. What might they be? How could we address the inefficiencies? I know we could be here the rest of the day just talking about that question, but or barriers. So let's talk first about, do we see inefficiencies? And then let's address how can we cure the inefficiencies? And then how about incentives to expanding systems of care for those who are in, again, the intersection of mental illness, mental health, substance use, and homelessness.
Well, I'm not an expert in this area, but I know that one very significant problem is the sharing of data. And certainly folks are trying to address this challenge. So supporting data collection, data transfer is very key. I have to do a note here. I'm going to just cheat for a minute, if that's okay.
Of course it is. Okay.
So we have a Robert Wood Johnson and locally funded initiative to create a data warehouse between Access and the 3 homeless management information systems to better coordinate that type of data. Then I don't need my cheat sheet to talk about another type of data sharing. So it's called the closed loop referral system. So the state's health information exchange, or Contexture, recently last year went out and procured a closed loop referral system, or CLRS. And a closed loop, and this is actually an initiative of Access under our whole person care initiative. And the purpose of a closed loop referral system is, so when I go to my provider and I tell my provider, based on some conversation, that I may have some food insecurities, Today, the provider might give me a sheet of references of where I can go. I can go to St. Mary's Food Bank, and then I thank them and I leave, or I thank her and I leave. But tomorrow, if she would implement a closed loop referral system in her physician's practice, she would actually put in my referral to St. Mary's Food Bank. St. Mary's Food Bank would pick up, of course, I'm picking on them if they choose to participate. They would pick up that referral. They would potentially do some outreach with me. And then when I come in to get my food, there would be information sent back to my physician, which closes that loop to ensure that we're not just telling people what resources are available, but we're actually looking to make sure that they receive them and making sure that the records show that they received them. Otherwise, we can continue outreach. So those are a couple examples.
Excellent. Amy?
I agree, data. We need to be sharing data better. I think flexible funding is also critically important. So often people have funding allocated, but they can't spend it on this or that, and then that leaves a gap. And you might have 80% of the funding, but you don't have that 20%, and that leaves a hole in the program that makes it not sustainable and not effective. So that's absolutely an issue. I think the other lesson here, I think, came from the pandemic. The silver lining of that was that we got a lot better at working better together. And I think there are many lessons learned there, and I just hope that we don't forget them. And there were real opportunities amidst that crisis, and it'd be great to figure out how do we institutionalize this moving forward.
Are there incentives that you think that we could specifically bring to bear to expand our systems of care? You talked about, I mean, you made a great point about data sharing. That in a sense, that's an incentive because it works so well. And then what Amy's comment just a moment ago, but are there other incentives that perhaps could be used? If we're thinking creatively out of the box, it might help here. Yes, please.
So what we've done at the housing department is try to incentivize the service providers with our cooperation and leveraging of funding. So between the agencies working very closely with Access, with Department of Economic Security, and all their funding streams, and working with the service providers, especially those for providing permanent supportive housing, which is one of the best solutions, long-term housing solutions for persons experiencing mental illness and substance use, is telling we're on their side, we're helping them create ways of creating sustainable funding for the long term to make sure that those housing operations can get funded at the beginning. You know, getting them built is easy, especially right now with all the federal funding coming down. Getting them built is easy, it's sustaining them over the long term is difficult. So we're working on methodologies to braid funding sources together and help them bill Medicaid, be more efficient with billing Medicaid for what they can, and finding other funding sources for the rest of the wraparound services they need to do.
The court participated in a county process over the last several months that involved dozens of people and hundreds of hours to map out the court-ordered treatment process. And that it's about 30 feet long of how complicated our system is and how we're coordinating, how folks come through and all the different moving pieces. And just for context, we're 3 paragraphs of that background report. So what we do is incredibly complicated. And one of the things that's come up is how much data we could be sharing internally, externally, with law enforcement, with hospitals, with providers. And so I'm hopeful that that will be part of an efficiency that we can work towards.
We have a couple questions from you, and I would like to ask our panel these questions. And this actually ties into, Sarah, what you were just mentioning, I think in part with the mental health courts. Is there enough capacity to provide inpatient mental health treatment, in particular addressing court-ordered inpatient treatment? Do we have enough capacity?
I don't know. There have been, in the last several years, what we do has, in the last several, meaning the last 4 years, we've gone from 1 full-time judicial officer to 4. So we've quadrupled. We are driven by how many beds Valleywise, the county REBA, has built. So there's this beautiful new facility in Maryvale. I guess it's not new anymore. Still feels new. We are driven by how many beds they can staff. So right now, my understanding is that it's a struggle to find enough psychiatric nurses and behavioral health technicians to operate all of the beds that they've built. And I don't think that's nobody's fault. There's what COVID has done for healthcare providers and staffing at hospitals in general. This is just a part of that. So I don't think we are operating at full capacity to know if we have sufficient capacity. Unfortunately, I don't think I can, and I'm not trying to punt. I just truly don't think we've gotten there yet. The county has built all these beds and is working to create other solutions for folks at the front end of the evaluation process to build that extra capacity. We're trying some creative solutions, but at this point, I think the stars have not aligned yet to know the answer.
Okay. Shelli, I think this is in your wheelhouse. Did access apply for the IMD waiver exclusion for long-term care? And for those of us who are not into acronyms, IMD is? Thank you. Okay, so did access apply for the waiver?
So we did.
Oh, thanks.
Thank you. We did actually submit a waiver request for the IMD. So I'll just give a minute of background on this. So an institute for mental disease is any institution, and there's a broad definition of that as well, that predominantly serves mental health issues. And I'm not an attorney, so that's the finance person's explanation of it. The IMD limit says, and this is a huge problem with this same question of inpatient capacity. The IMD limit says that Medicaid cannot pay for more than 15 days of inpatient care in an IMD in 1 month. And that's cumulative days. It's not consecutive days. So you have providers who, and an IMD, this exclusion, a couple more things. The exclusion applies to members aged 21 to 64, and it applies to facilities that have more than 16 beds. So all those things have to be considered. So if you're small, if you're a very small inpatient facility of 16 beds, I think it's 16 or less, then we don't have a problem. Or if you're a child or a senior, we don't have a problem. But for the bulk between 21 and 64, we have a problem. And so we have providers who have determined that the medical necessity says that this person requires more than 15 days in the month of April for this person to receive treatment. And there's not a payer for that. So it's a difficult conundrum. At the same time, it's a difficult conundrum because Medicaid covers medically necessary services. So we have this kind of confusing dilemma where we can only pay for 15 days, but we have to pay for medically necessary services. I think the misnomer is that the IMD waiver will solve everything, and it really will not, because the IMD waiver itself still has a limit. I think it is 45 days on average. Now, absolutely 45 days is better than 15. Obviously 45 days is more than 1 month. So we can understand that it's not 45 days in a month. I don't remember what the period is, but it's 45 days in aggregate, and certainly do have members with greater needs than that. Beyond that, there is a tremendous responsibility on the provider who chooses to participate under an IMD waiver with significant reporting and performance metrics. So even if we get an IMD waiver, it's not going to be anything like our program used to be before that restriction went in place.
Thank you. We don't live in a vacuum. We're, one of 50 states, one in a world of many countries. Are there any cities, not necessarily local to Arizona or the United States, but elsewhere, cities or counties or countries that you think we could learn from and that are effectively addressing this intersection of homelessness, mental health, and substance use?
I definitely do not have that answer. I would just say to you as humbly as I can that Arizona Medicaid leads the nation in what we're doing on housing and homelessness.
Okay,
So
please,
in
sir. Yeah.
a similar, I love to travel, but I have no idea what the answer is. To toot our own horn, I recently heard from a psychiatrist who was from the Midwest who thought that our statutes and who we can treat in Title 36 court was significantly broader than what she could do. I think she was coming from Missouri and she felt like she was actually able to take care of a lot more people here than there. So the opposite answer.
Oh, well, that's
Also,
okay.
we're
It's nice to know
fantastic.
that we're, ahead of the game in some areas. We have a question. What does the Department of Housing do for people experiencing homelessness? Pretty broad question.
Yeah, that is a broad question. I'll use my microphone this
Yeah,
time.
okay,
Sorry about the last
thank
time. We are, the Department of Housing is actually a conduit of funding, federal funding, state housing trust funds, and we give that funding out to agencies who actually provide services on the ground or build housing or, interact with the community. So what we do is, and what the Director Simplot has been doing since he got here a year ago is convening and collaborating with other jurisdictions, with other state agencies, with service providers and housing developers, and trying to figure out where and how we can leverage our funding to the best way to serve, the most people. So I think, by collaborating and getting our funding out there, we have a lot of federal funding coming down, stimulus funding, ARPA funding, CARES Act funding, all of that. I think that trying to do it the best way we can to leverage and work closely with our sister agencies like Access, like Department of Economic Security, really putting the money where it's going to do the most good, following plans that were great plans that were developed like people like MAG, and so we're really working together and more in a partnership than I've ever seen before. I was the director of housing at the city of Phoenix, and I did not work together very closely with the Department of Housing at the time. They just weren't as collaborative now. And I think that Tom and I have come in deliberately trying to be collaborative and trying to work with all the local jurisdictions and really trying to do the most we can with our funding. So now we are funding, the heat relief, we're funding, we're talking about permanent supportive housing. We're talking about, how can we help with building a continuum of housing from shelter to transitional housing to permanent supportive housing for folks that they aren't ever going to be able to survive, not going to be able to get a job maybe and live in regular housing. So we're working on all of that collaboratively.
I think we've touched on this before, but in addressing mental health and substance use, is the place to start with housing? Is that the place that we should be starting? Or should we be starting somewhere else?
I think starting with housing adopts that housing first approach, which is proven to be very successful. People stabilize more quickly when they have housing. That being said, those supportive services, the long-term care in terms of the case managers is also critically important. So if we have housing with wraparound services, and I think that would be an extremely effective approach.
So really it's housing with wraparound services.
Absolutely.
Okay. We're about ready to wrap up with some very important thank yous before we finish, but let me ask one more question. I want you to imagine that we live in a city, a state, a county, and we have unlimited resources. Isn't that great? Boy, just call me Elon Musk. Okay. What action would you take if we have unlimited resources? What is the number one action you would take to address this intersectionality of substance use, mental health issues, and then with homelessness? What would that be? Absolutely,
I'll take
please.
this first one. Housing capacity. So we need to build capacity. And one of my staff actually pointed out, and as I was jotting down my thoughts, he added his thoughts and said, we kind of are at that point right now with unlimited resources. Cindy mentioned it with the ARPA funding and all the money that's coming through the federal government right now. We have a lot of money for vouchers, but we don't have anywhere to put people. In fact, a Department of Housing I know has been, I shouldn't speak for you, Cindy, because I'll get it wrong, but you've been buying like motels and defunct motels and hotels and turning those into housing. So I think building capacity, and I really want to give all the other panelists a turn, but I also have been dying to make one plug for access that's so relevant to today, a project I'm so proud of. And it really gets to the heart of the collaborative work that we've been doing. The Department of Housing a couple of years ago transferred $3.5 million in state appropriation to Access. Access took that money and released an RFP, a request for proposal, for a transitional shelter, transitional housing, I prefer the word housing actually, that we will be breaking ground on early this summer on the northeast corner of 24th Street and Van Buren. So right down the street on the outside corner of the Ash campus, outside of the campus, not related, excuse me, to the hospital. Excuse me. It's going to be approximately a 70-bed transitional housing facility. It is a bridge to permanency. It is not a homeless shelter and it is not a treatment facility, but actual transitional housing. One of the things that makes very unique, well, besides the fact that this is Access's first ever bid for building a housing setting, and the first time we are ever breaking ground, but in partnership also with Department of Administration, who is our construction vendor. So another collaboration. And one of the other things that makes it unique, besides all of those things that I just said, is it will have a co-located behavioral health clinic open to the public, separately licensed. Well, the housing, of course, is not licensed because it's not a treatment facility, but the behavioral health clinic, which will be co-located, will be licensed and open to the public, not just Access members and not just members living in this housing setting. We're super excited. I think it's going to take about 18 months, especially with today's environment. And we're hoping that we'll open to about 70 residents in October, November of 23.
Well
Thank you
done.
for letting me throw that in.
Absolutely, well done. Amy, what would be your number one?
I think it would be recognizing that safe, affordable housing is a basic human need and that we need to provide it accordingly.
Yeah, I'm sensing a theme here. Sarah?
Yeah, so build more housing, but build more types of housing that are attainable for people at every income level. We've lost sight of the old housing that folks could afford. If you're on disability and you have to pay for your healthcare and you have to pay for food and everything else you have to pay for, sometimes you can only afford to rent a room. But you can afford to rent a room and you could do that for a long time. And we've lost that type of housing. We haven't built public housing in years. We need more public housing that serves people who are extremely low income, 0 to 30%. And sometimes that's the last alternative of housing before you become homeless. So we need all kinds of housing that serve people at every income level.
Cindy, thank you. Sarah, last word.
I'm going to take a different tactic
Okay.
and say, if I had unlimited funding, I would double, triple, quadruple salaries for case managers, for nurses, for behavioral health technicians. They work so hard. They are the key of these relationships that help stabilize folks. And they, whatever they make, it's not enough.
Well, on that note, Evelyn, I'm going to ask you to come up. I'm going to take this down. I'd like to thank our panel. Ladies and gentlemen, great job.
Outstanding. Thank you, Pat. Our panelists, I think, and I hope that all of you here in the room, as well as the folks that are online, are inspired to gather the folks in your communities to have a conversation, because Tom mentioned, all politics is local. So that's where it needs to happen. And they've all said this, our panelists have said this. So thank you again to Pat, our panelists, Morrison Institute, for all of your hard work. Let's please give them another hand. Special thanks to the law school for hosting the event and our financial sponsor, once again, Halle. She is part of the research committee as well, and to help that helped create the background report with Pat as chair. Halle, please come up and say a few words.
Thank you very much and welcome, and thank you for attending to those in person and those virtually. I think town hall, first of all, I want to ask you all, get one of these bands put it on, wear it, and invite 10 friends, like Noah's Ark, okay? 5 pairs, to come to the town hall meeting in November. I think it would be great if we had to go to the Phoenix Suns arena to do town hall. I think that because I don't know of another form for civic engagement and civil engagement that challenges you and you learn so well to listen and to think with a goal of reaching consensus, because that's how town hall works. You'll sit in a room, you'll talk about the things we talked about, but at the conclusion of each little session, the group produces a consensus statement. If I had had town hall when I was a law student, I'd be a much better lawyer. I would have been a better mother. I would have been a better spouse. Might not have gotten a few speeding tickets when I didn't deal with the officer. So it's such a valuable way to spend a weekend. And that's why I support it. I've supported it in other ways in the past. I went to one of the most remarkable events of my adult life in the prisons, where there were community town halls. And town hall wisely, as they do most of the time on everything, went to the prisons on the topic of how do we have healthy families? No surprise, most of the folks in prison didn't come from a healthy family, but they're mostly going to be leaving. And they were leaving prison, they were so engaged about how to create a healthy family. I went with a senator, Senator Nancy Bartow, and she shared personal life stories with those inmates that were remarkable. That kind of engagement, I believe, on this topic in particular, substance abuse, mental illness, housing, is the intersection of public health and public safety. It's there. If we make strides in this topic, we will improve the quality of life and quantitatively all the things that we measure in public health and public safety. So I can't think of a more important topic. I highly commend the report that was written. I played a very small role on the research committee. The people who wrote that report and the Morrison Institute, this is going to become a treatise. It's going to be looked at nationally, maybe internationally. It's going to be the baseline for how we look back over the next probably 5 years, maybe longer. It's well-resourced. It's written in plain English. My Lord, how hard is that to accomplish when we start writing reports? It's relevant. It addresses all the topics that we addressed, and it's written by subject matter experts. In that report, there are some wonderful resources, and I want to shout out to another report with Morrison that was funded by in an individual group, the Chuck and Laurie Dr. Charles and Laurie Goldstein Foundation, which along with the Baptist Health Foundation, and the Morrison report relied on that in substantial measure. The key phrase out of that report, I think we need t-shirts. Maybe I'll donate them to town hall. Housing is healthcare. As I came in today, I looked out at that corner at 2nd and Taylor, and I thought, wow, this corner, Cambridge Square has nothing to above this, really. This is a phenomenal corner of young people and education and a downtown environment. So imagine that you had COVID or a broken ankle or a laceration or a migraine headache or a hysterectomy, and you were trying to recover from that in an alley. You don't have a roof over your head. You don't have food. You may not have water. You don't have anybody to help you get up. You don't have a place to go to the bathroom. What if you soil yourself? And if you sleep there too long, hopefully the police are going to come and maybe they'll try to help you and maybe they'll get you to CAS. And if you happen to have a mental illness, it's even harder. Now, my job, my law firm does partly criminal work, now almost exclusively with individuals with mental illness. Major felonies often, but we cover the gamut. If you've exposed yourself, if you're charged with exposing yourself because you were urinating in a park in Scottsdale, then and you're mentally ill, then we'll help you get out. Or if you're charged with murder. We also do health law, typical, so we represent providers. It's kind of odd, right? And we sue jails and prisons for civil rights violations. Over time, my practice evolved intentionally to focus on mental illness. And I tell you this only because I came here personally, not professionally. It was a conscious choice. Go back over 15 years, a young teen, one of our children was a young teen struggling with some mental illness issues. And but for the fact that her father was a physician and her oldest brother was at home and he was a Navy SEAL medic, I'd have 3 children. She would have died in her closet. As a minor, she's not, oh, I shouldn't have said she, the child was not eligible for SMI designation. But being a mother who's a lawyer, we figured out how to get her adjudicated a delinquent, therefore could be court ordered without all of the other difficulties. And thankfully, for one reason only, we had the means to write 5-figure checks a month for about 6 years to get her the best care that money could buy. And so with science and love and money, that child is now mid-30s, honors graduate from this university, honors masters from this university, and a highly successful medical billing collection information services person who's built and sold 3 companies and does better than her parents ever did. She is the exception. And what we need is not what we could give an individual child. We need a system that makes that possible for everybody. And what we have today, what I heard today, is the most encouraging, uplifting discussion about facts and plans and strategies, bolstered by what I believe is the best single report on these 3 topics that I have ever read. And I believe it's going to become a treatise in the industry. We won't be as famous as we are for access, which is what brought me to Arizona, by the way. I came here to take a job at Samaritan out of the Reagan administration because I worked on the first access waiver. That dates me in terms of age, doesn't it? But it's an enormously important event in terms of potential. So please get your band, put it on, and invite 5 pairs of your peers, you know, elephants, giraffes, whatever, and come to town hall and participate. You'll make a difference and you will leave a changed person. I can promise you that. Thank you.
Halle, thank you for your words and your generosity. So to close, I have 4 quick items. So first of all, Arizona Town Hall and Arizonans, like all of you, will make a difference, as Halle just mentioned, engaging in local and statewide gatherings, as well as the event that we'll have in November, to come up with solutions to catalyze solutions that work for our diverse, very diverse Arizona communities. Secondly, this event has been recorded, correct? And the video will be posted to YouTube. So to our YouTube channel, Arizona Town Hall YouTube channel. So if you need to inspire some of your elephants and giraffes to join the town hall event, we have our words are immortalized. Third, if those of you present, those of you who are present, you're invited to stay for a luncheon program and visit the informational tables. Where is the luncheon being held, Tara? Okay, great. And last, contact us to arrange a community or future leader town hall in your area. We so are appreciative of all the generous partnerships of the Halle Foundation in supporting the ability for us to do more this year. Thank you again for joining us today, and we hope to see you at a future event. Thank you so much.